yes, it's a problem, but it's not a problem big enough, because if it was, then he would not be earning.
Yes.
So
Yeah.
there is a direct
How is he
correlation.
functional?
Yeah.
How is he
So he's
working?
functioning. This is what he needs. This is what he needs to
Yes.
do. So he does it, and that's fine. And there's a, it's just like a symptomatic, like putting a band-aid over the situation, and just
Being an educationist, I think our education system has always focused on IQ.
Yes.
And most of our most of us children who pass out are have very good IQ.
Yes.
But EQ is never the focus.
The emotional quotient is
Yes,
always
the emotional
neglected.
quotient was never the focus. And as an educationist, what I observed in the rehabilitation program that runs in Hermitage.
Hello everyone, I'm Namrata and I'm a family counselor at Bhatia Neuropsychiatric Hospital and the Hermitage. So we have come up with this episode where we're going to talk about addiction and its treatment. So addiction usually is the most complex, most stigmatized and most mysterious illness in the society, and it is very sad that very few people know that it is treatable. One, there is lack of awareness that people don't understand that it's a disease, and second, there is a lot of stigma revolving around it. But Dr. Bhatia and his team believes in presenting the solution oriented approach and hope to all the people sitting out there, if you're facing such problem in your family, there is a solution and there is hope. So today we have Madhuji and her son, the mother-son duo, who are there with their story, their journey from addiction to recovery. So hello, how are you doing?
I'm good, thank you, Namrata.
good. Thank you very much.
So, to begin with, how did your journey start? I mean, I understand that anywhere in the family where there is addiction, there is lot of pain and trauma. So, pain and trauma is known to everybody. So, how did you reach Bhatia Hospital, and how difficult was it for you to understand the disease concept?
So I think, like everyone, uh, not knowing that addiction is a disease was also something that we believed. We also felt that it is a moral issue. Uh, and we did seek medical intervention, but I think on an average, like for everyone, it took us about um, 12 to 13 years to reach the right place. It's not that we were not going to a psychiatrist or a psychologist, but I think that teamwork that was required, we were not getting anywhere. So somewhere Anirudh was in the picture and I was not there, and somewhere I was in the picture and Anirudh was not there. So either he didn't have trust or I didn't have trust. So I think it's only when you have this wholesome team, um, where the role of the patient, the doctor, the therapist, and the family,
A holistic approach.
a holistic approach is there. I I think that's what worked for me, and so I believe that that's the solution to the problem, or that's the approach to to reach on the other side of the problem. So yeah.
So, usually when we go for other illnesses, of course, family is needed everywhere. Families are the caregivers. But why is it that in addiction, the family role is integral? I mean, you as a patient, Anirudh, and even you as a family member, what is the role of family in this treatment?
Uh, I think somewhere most people believe this to be the case, whether they're addicts or even if they're family or outside in general, that willpower
Willpower will work.
it will work. So if anyone wants to get better, they will get better. This is a narrative, and that is not without merit. It is not unwarranted. It does hold some value to it. In fact, a lot of value to it. But there is a point where addiction, if it is considered as a mental illness, and then when
A brain disorder.
a brain disorder, mental illness, then if it is navigated around with that in mind, then what happens is you have what you would for any other mental illness, the pretext that the person is not capable of making their decision,
That decision.
let alone having the motivation to come out of it.
Yes.
Now that is where the family
Role comes in.
that comes in. They need to understand this aspect that it's not willpower. That will come at another stage. For example, it does happen a lot that families do bring their patients or their the addict in the family. They bring them into treatment. They go back out, relapse, keep coming back. So this happens a lot. I think at that is a point where yes, that it is very clear that the person does not want to get better, but you have to still keep trying, right? So the family's role is important in understanding that it's a mental illness, and that willpower will not manifest uh, just out of the blue somehow.
So the message here is that the very reason that the patient has a disease or brain disorder, and if your brain is not functioning properly, you don't expect the patient to take a decision for himself or get himself treated, and that's where your role comes in.
And
so
yes,
how it was, what was your role and how difficult was it for you?
so first, as Ani said and as you said, was to bring the patient the to the place where he or she will get medical intervention. Now,
Yes.
that's the first stage, which the patient will never come on their own. Family has to show the tough love and bring the patient to the treatment place. That is first step. And the second step is, as caregivers, we have neglected ourselves for a very long time.
Right.
So when you bring the patient, you also have to learn how to take care of yourself while caring for the patient.
Yes.
And also learn the skills of how to change the environment at home
Yes.
once the patient comes back. Because
Right.
if the environment remains the same and the patient changes, you are bringing a half-baked cake.
Yes. Yes.
So you have to learn the skills of how to support the patient when the patient while the patient is doing the treatment, because there will always be there'll always be this tug of war between the patient and the family, that the patient needs to go back.
So do you mean to say that a typical model addiction family, the family environment is full of unhealthy behaviors and toxicity and conflicts and relationship, and that is where addiction has taken place. So you can't keep the person healthy and recovered in that place.
Yes, I think conflicts and in the environment is normal in other families also, but in our families, the conflict leads to
Little
toxicity.
yes,
And that toxicity has to be removed. I'm not saying toxicity is not there in other houses, but particularly in our
It becomes
families,
pathological.
Yes,
The whole house
Yeah.
environment becomes pathological.
There's a lot of codependency,
Yes.
a
And
lot of things happen. A lot of things happen which manifest as sickness in the household, and that needs to be worked on in totality. It cannot just be worked on through one person.
So we need a platform where the family is also healing itself and learning and managing. Another stigma is this word, so-called center. A place where, because people don't understand that addiction is a disease, and when they are fed up, they just go and dump their patient there. So whereas scientific research has brought this beautiful program of rehabilitation training program, and people usually feel that medication would do the needful and there's no requirement of training. They don't understand that it is treatment of brain and mind. So Anirudh, my question to you is, do you think that rehabilitation training program is actually needed for a patient to be in recovery? What was your thinking in the beginning and how it changed later on?
Okay, I'll just talk about one particular thing here. Um, in India, mainly in India, most of the people in rehab are young males, and there are those males that need or that have a need in their life to settle themselves financially.
Right.
And there are other societal pressures,
Right.
such as either get married or if they're married, then taking care of their families. So that's a huge white elephant
Yes.
in their lives.
Yes.
And in fact, that is uh, if you see clearly that if any family brings their young male into rehabilitation is because of a dysfunctionality in their life, the biggest one of those concerns being financial instability or lack of a constant flow of finances, and then therefore lack of responsible behavior in that mm, young man's surrounding. So if that is fulfilled and the person is in addiction, neither will the person ever agree to walk into a rehab.
Right.
Well, the person will almost never agree to walk into a rehab, but the family would also be like, but this person is earning. Our son is earning, our husband's earning.
How
This
can
is
he
what
be in a rehab?
yeah, I mean, this is yes, it's a problem, but it's not a problem big enough, because if it was, then he would not be earning.
Yes.
So
Yeah.
there is a direct
How is he
correlation.
functional? You know,
Yeah.
how is he
So he's
working?
functioning. This is what he needs. This is what he needs to
Yes.
do. So he does it, and that's fine. And there's it's just like a symptomatic, like putting a band-aid over the situation and just uh, going through it. Now, when I came into rehab, um, I was already not very happy about the fact that wasn't financially independent. I still am not, even after 5 years of treatment. So it does take time. Um, Also, when you come in here, there is a feeling that how much ever time that I need to spend in here is that much more time when I am not earning. Now, it's not just in India. This is across the globe
Global, yes. Globally.
that a young male will feel, and I will use the word emasculated by
Yes.
this fact that I am not earning, and because money does have an energy of legitimizing any behavior.
Yeah, it's needed. Definitely, it's
it
needed.
and unfortunately, it has a legitimizing effect in today's society.
That it's
Anywhere,
okay if you
but it's
are-
okay. You can be any which way, but if you're making money, all good. But if you're not, then even if everything is a-okay, then it's still not considered of any
Exactly.
value because
Yeah.
there is no money coming in.
Yes.
Now, this is more true for men. So they do feel that this
That's
gap.
what you felt in the beginning.
Yeah, and a lot of people do feel this, and speaking to other addicts, and even now speaking to people who are in the recovery space, this is the concern that they have, that there should be some sort of soft skill training or some sort of development which helps the person in rehab to get trained and also get reassured that work is being done. Like even in jails,
Yes.
there's an education program that
Yes.
if someone those that
So
do want
sorry,
to
I'm
reform.
interrupting, but do you think our Hermitage structured program could do that needful in your life?
For me, yes, because I'm a musician, right, by trade. I'm an actor. Um, so when I was in here, it was a situation was provided, or
was presented.
yeah. No, it was
Provided,
presented,
yes.
provided.
Yeah.
It was provided. It was allowed for me to practice my music. It was allowed for a teacher to come in and help me with my musical training. In fact, I remember there was another very dear friend of mine. He was admitted with me. He's a professional musician, professional singer. So, in fact, there were certain activities that were allowed for everybody else, but for the two of us, they're like, nah, instead of that, you can go and practice.
Yes.
Like there is
Because
a
that was your
that was
your need.
that was our need. It was very clearly identified that this would help us with our recovery, and I can very easily pinpoint to that being that being the force which actually helped me come out of the addiction, which actually helped motivate me personally to to say that I don't want to use anymore. Not that I can't use anymore. I don't want to use anymore.
That there is something to look up to, when
Yes.
you go out in the world again.
And-
that you don't need the substance anymore.
Which
you
is
have something.
unfortunate, because most of the people, like we're in Punjab, it's very unfortunate here. A lot of the young guys that come in here, they've been using since they were probably like 11, 12, maybe 15, 16.
Yes.
And their progression towards hard drugs is not the way we progress,
Yes.
because that was about maybe 7-8 years before it got to that level. Here the availability and the mainly the availability, is that when they start with the hardest drug there is.
Yes.
And the euphoria that is created within the neurophysiological structure
Right.
is so huge that a person cannot think about anything else,
Right.
because they know that everything gets fulfilled by
By
maybe
the
just
substance.
but
Yes. So I think that is what people don't understand, that rehabilitation training, why it is needed, because.
Can I add something
Yeah,
to
sure,
this?
Sure.
Being an educationist, I think our education system has always focused on IQ.
Yes.
And most of our most of us children who pass out have very good IQ.
Yes.
But EQ is never the
Yes,
focus.
the emotional quotient is
Yes,
always
the emotional
neglected.
quotient was never the focus. And as an educationist, what I observed in the rehabilitation program that runs in Hermitage is that it focuses on those EQ skills. And we all know that in today's day and age, EQ has been one of the very important factors.
Yeah,
because
we don't know how to handle our emotions.
Yes, and technical skills you can be equipped with technical skills
Anywhere,
anytime.
anywhere.
But the soft skills, the emotional regulation, the way you interact with people, your communication skills, how to
Work
to
in a
be
team.
work in a team, how to be motivated,
How to work
have
on yourself,
self
your character
motivation,
flaws,
how to become a better person.
Yes.
So you create value wherever you go, is what is the focus when you do rehabilitation program. Having said that, it ends up boosting your self-esteem.
Yes.
Yeah. So I think it's a very important program which should be there everywhere, but to that extent we feel lucky that we were here, and so with him we also got the training.
So I'm afraid that we don't have much time today, but since you, mother and son, are here today at this platform for hope, for inspiration, for so many people out there. So what is your message to the society, to the people who are listening to us, who are gripped in this addiction and are looking for way out?
So my message is that because the addiction is a disease that takes you to the hospital after a very long time. So the treatment, when you enter the hospital or the program, the treatment also will be long. Yeah, because it's not only
takes time.
body, it'll be mind, it'll be thoughts, it'll be behavior.
Behaviors.
So it's going to be a long treatment. It'll be time consuming, and therefore my message to everyone is that give time and have patience. It will happen. It's very organic. You wouldn't even know. Uh, and second, very very important factor is be involved with the patient's journey, but don't interfere in the doctor's treatment. So have trust in the doctor. So this is what I did.
What's your
I will actually
message?
relate this with my profession, which I am pursuing, acting. So a lot of people have told me that your chances increase if you spend more time, perhaps say connecting with people who are in the industry, like casting people, producers, directors, or being in Mumbai, being in those circles. Now they say if you go for 6 months, you have so much chance. If you go for, like, maybe if you stay around for a year, your chances probably increase maybe a little more than double. Then 2 years, they go to 4 times. It's like the longer you stay,
Geometric progression.
there's a geometrical progression, right?
But there's one very important part of our function, which our program, which I forgot to answer. How important it is to remain connected to the program, the follow-ups, because you said that we have to go back in the society, and substance is all around us. So what keeps us in recovery and the program, Anirudh?
See, and I will say this from my perspective as an addict, right? It is not fun and games. The program rehabilitation is a deterrent. It is very much a deterrent, like a legal, justice system that
Protects you.
that puts you behind bars, and
Yes.
it is that, right? Now, when we come back for a follow up, the first thing that happens is we get drug tested. Now, I know that we are very good at lying. So even if we go back after rehab, we know in our and if that hasn't struck that we don't want to get better, we will do everything in our power to make sure that we continue using without going back. So what could happen is a situation where you start using, but you become more careful because you're like, I wouldn't want my family to know, because then
Right.
that it repeats the
Right.
circle.
Right.
Now that all gets trumped with a follow up.
The
Because
follow-up.
if you're coming back after every week or after every 2 weeks, depending on where you are, you will get drug tested. And that drug test,
Is a
there's,
check.
there's no way to cheat that.
Yeah.
There is no
and
way to
we
cheat that.
revise the program.
Yeah, that
We revise the skills
Yeah,
which we
Of
have
course.
so
learned.
that is first, and the second is that it is a revision of whatever we have learned. So, like physical and soft skills, so you have a revision of soft skills here, and uh, the connection that you make with people wants you to come back
the
again.
reassurance the reassurance that a person will not use or has not been using is the drug test. So yeah.
Thank you so much, both of you. And I end up with this message that please treat addiction as a disease, and it definitely has a solution to it, the recovery program. Yes, we need time, patience, and surrender, but then that is why, we have the example here that there is hope and people can be happy and successful and healthy in life after the treatment. Thank you so much.
Thank you.
Thank you.